Okay. If you were told that you had less than 6 months to live, would you rather die a slow, painful death or a fast, painless one? When phrased this way, most people would say they'd rather die a fast, painless one. However, when the phrase physician-assisted suicide is attached to it, many people tend to change their mind. There's a common misconception that needs to be cleared up about physician-assisted suicide, as well as some reasons for and against it, and some stories that help highlight the reasons for it. In my opinion, physician-assisted suicide should be legalized nationwide because it gives people who are terminally ill the chance to end their life if that is what they choose to do. According to the Oxford English Dictionary, physician-assisted suicide is a suicide carried out by the assistance of a physician, obviously. However, many people tend to get physician-assisted suicide and euthanization confused. They're pretty much the same thing, but in euthanasia, the physician themselves give the patient the lethal medicine, while in physician-assisted suicide, the patient gives it to themselves, usually by mixing it in water and drinking it. The first major advocate of physician-assisted suicide was a man named Dr. Kevorkian. According to an LA Times article by Dennis McClellan, Dr. Kevorkian, between the time of 1990 and 1998, assisted in killing about 130 people. Pretty much the entire time he was on trial because people believed that what he was doing was wrong. However, they never had any evidence to prove that he was doing anything wrong until he videotaped himself giving a patient the medicine because they were not able to do it themselves. After that, he was sentenced to jail time, and a couple years ago he died. However, he was able to start a movement with some of the states to allow physician-assisted suicide to start being legalized. According to an article called State by State Guide to Physician-Assisted Suicide, Oregon was the first state to legalize it. It started in Oregon in 1998, where it became a law, and moved to Washington, Vermont, California, and Montana. The states that are a little lighter have legislation currently in progress to make it legal, and the darker colored states do not. In California, the laws and the rules for physician-assisted suicide are very clear, and it is in the End of Life Act. According to the act, the patient has to meet certain requirements to be able to actually ask for the prescription. These requirements include they have to be at least 18 years old, they have to be terminally ill with less than 6 months to live, as categorized by 2 doctors. They have to give 2 verbal requests at least 15 days apart. They have to give 1 written request with at least 2 witnesses, and they have to be deemed mentally capable of making this decision themselves by 2 doctors and physically capable of actually doing it. These laws and rules in the act show that it's not easy to get this medicine, and a lot of people are worried that it's too easy and that people will abuse it. However, because of these rules, it makes it pretty difficult to actually get it, which eliminates that problem. I talked to a sophomore here at Pepperdine, her name is Julia Sneeden, and her uncle was considering physician-assisted suicide. He was given about 2 months to live because he had terminal cancer, and he didn't want to go through the pain of having to die on his own, which is what many patients fear. They don't want to have the pain of the actual disease killing them. However, he was in a state that did not have legalized physician-assisted suicide, so he had to resort to starving himself instead. A common misconception is that starvation is a good alternative to physician-assisted suicide. However, with physician-assisted suicide, it takes about 5 to 10 minutes after taking the drug to pass out, and then you die in your sleep about a couple hours later usually. However, with her uncle, he died in about a week and was awake for the whole thing and felt the agony of going through that pain. So the whole point for some people is to eliminate the pain, but starvation obviously doesn't eliminate that pain. Another big advocate, who some of you may have heard of, is named Brittany Menard. She was born in California and has lived here her entire life. According to an article called Physician-Assisted Suicide Legalized in California, she was diagnosed with terminal brain cancer and was given less than 6 months to live. She wanted to use physician-assisted suicide mainly because she didn't want to lose her autonomy, which is another reason many people believe that it's the right path for them. However, since she was in California, at the time that she was ready to take her life, she couldn't because the law was not in place at the time. So her and her whole family had to move to Oregon in order for it to be something that she was able to actually do. She was able to die with her friends and family all around her in her bed, which is exactly what she wanted and what a lot of other patients want as well. A reason that many people do not believe in physician-assisted suicide is because of their religion. A lot of religions do not think that suicide is a good way to end your life, and many people do not believe in it because of this fact. However, at least in my eyes, just because the legislation is in action does not mean that you have to use it. According to the Oregon Death and Dignity Act data summary, since the time Oregon legalized it to now, there have been only about 1,500 people who have actually wanted the prescription, and from that, only 64% have actually used it. So just because the legislation is there doesn't mean that it's necessary that you actually use it. So just because your religion goes against it doesn't mean that you should take that opportunity away from somebody else who may not have the same beliefs as you, but wants to have the opportunity to end their life the way they want and how they want. Another reason people tend to go against it is because they believe it's too expensive. However, according to an article in the U.S. News and World Report, the drug that is used, which I cannot pronounce, but is usually about $450. And considering that it's only that expensive and how much life support may cost if you have to stay in the hospital for a long time, it's a lot less expensive than that would be. Also, it's covered by most insurances, so honestly, expenses shouldn't really be an issue if you're insured. I urge you all to go on to deathwithdignity.org. This is a picture of their homepage. You can look and see what different states are and where they are in their legislation. You can sign petitions. Right now it's in Florida to have the legalization of it. You can declare your support and just tell your friends and get the word out, or you can thank a DC council member for passing it. And this is a great way to just be aware and to allow other people to know what you're talking about and realize that it's not the same as what they may think it is. There are a lot of steps being taken to legalize physician-assisted suicide in all of the states. There are reasons such as they don't want to go through the pain and suffering, or they don't want to lose their autonomy, that many patients believe is a good reason to have physician-assisted suicide. There are other reasons, such as religion expenses, that also are there, but those can be overcome. If you help, you have a chance to end, or at least give somebody hope who's in current misery right now, that there is a way to end their life, or just give them the idea that they have this opportunity. The question is, will you help? Thank you.